Your doctor might have told you to come to pelvic therapy, and maybe you were having a urinary issue or a bowel issue or a bladder issue, and you're thinking, what are squats going to do for me? This is what patients come in thinking a lot of the time. My name is Nari Kaur Clemons, and I'm a certified pelvic rehab specialist. Patients come in all the time and they're like, I don't know why I'm here. So let's talk about what is pelvic therapy. Pelvic therapy is an area of physical therapy that came about, it's been around for like 40 years now, 30, 40 years now, but it's become a lot more popular recently. And when you go to a pelvic therapist, if you're seeing a true specialist, and that means someone who's taken many courses specifically in this, they are specially trained to help you with issues of bowel, bladder, and sexual origin. So this could be pain with sex. This could be that you're going to the bathroom all day long, like you're always running to the bathroom. Or maybe that you've had constipation that hasn't responded to other things. Or you have irritable bowel. Or you had a C-section and the scar has still been hurting you. Or maybe you had a vaginal birth and when you sit, it kind of hurts. Maybe you had part of your colon resected 10 years ago for cancer, and you still have this feeling of tightness there. Your bowels still aren't emptying right. Maybe you have this persistent pain that's grown in area in time since it's happened. These are all things that we see all the time as pelvic therapists. And so a pelvic therapist is somebody who is specialized to help you with problem solving in these disorders. Now, one of the problems is if the person that you're seeing is not certified, they may just be telling you to do Kegels, and Kegels is such a small fraction of what a pelvic therapist has you do. Kegels are like, that's like saying you went to a normal therapist for knee pain and they gave you one quad exercise, and that's what all physical therapy is. But if you're a high-level athlete, you know that your training and the work you might have done with a rehab specialist is much, much more than that. So if it's a good pelvic therapist, they should take a lot of your history and make sure that they're trauma informed. So if you've had a history of trauma, you definitely want to go ahead and tell them about that early on the first day so they can keep things in mind and maybe watch for signs of dissociation that you might be having during your treatment. A good pelvic therapist will do an internal assessment on the first day. There's 12 different muscles in there. They're going to want to see how all those muscles are doing. How are your support structures doing? Make sure to see in almost 20 to 30% of births, some of the muscles pull off the bone. So what pulled off? What is damaged? Where are your strengths? Where are your weaknesses? They will want to check the tone of your abdominal wall and how that is doing. So these are all things that are going to happen with a pelvic therapist, and then they're going to do very specialized rehab for you depending on exactly what your issue is to help you through it. To learn about pelvic rehab as the whole, or to learn tips and tricks for your bowel, bladder, and sexual health, go ahead and hit that subscribe button. Thank you.